Hi, L.B.Johnson students. My name is Elena Reyna, and I just want to talk a little bit about how important it is at your age to start thinking about what is it that you want to be when you grow up, because it's going to get here fast. Before you know it, you're going to be graduating from high school, and you're going to be stuck with that question, what are you going to study? So I, like you, was a high school student one time, and I decided to become a math teacher because I was very good at math thanks to my middle school teacher. And I really liked teaching, so I went straight out of high school, went 4 years to TAMU, got a degree in mathematics, and then I started teaching at my high school, which is Cigarroa High School. I taught there for about 5 years. But somewhere in between those 5 years, I started thinking that because it was always between math teacher and nurse, and I decided to change careers. It was not easy. I had to quit teaching. I had to quit a salary. I had to go back to school and actually be with younger students, pursuing nursing. And it was a lot harder for me to become a nurse because I was a single mother of 2 boys, and they were very young, and it was very hard to study. I had a lot of support from my family. If it wouldn't have been for my family, I would not be where I'm at today. So I went back to school, became a registered nurse. It is a very demanding program. There is a lot of studying to do. I had to go study at McDonald's, at all these places, because that's the only place where I could take my kids and study at the same time. But it is doable. If I did it, I feel that if you know what you want, and you have the support and you're very dedicated, you can be anybody you want to be. So I became a nurse, and I started working at LMC, Laredo Medical Center. I started working in the second floor. It was a med-surg unit. It was quite an experience. Nursing is a very rewarding career. You get to literally make a difference in your patient's life every day. It's a job where you never sit down. You're always busy. 12-hour shifts go by really quick, and you're really amazed at how you can help people. You're in charge of maybe 7 to 8 patients at a time, and you pass medications, you administer medications, you treat the patient based on the plan that the doctor has already laid out for you. But most importantly, you're the one that's there with the patient all day. Anything that the patient needs, your patient codes, if they stop breathing, if their heart stops, like, you're the one that initiates everything. Like, you press the code button, the doctor comes from the ER, the code team, and you have to basically tell them what's wrong with your patient and why is the patient there, what did you find. So you're a very important player, a team player there at the hospital. I really enjoyed it there. From there, I went to ICU, which is where the patients are very critical. And there you have a lot less patients. You have 2 or 3 patients, but keep in mind that those patients are between life and death, and they have, machines like ventilators, critical, IV medications that are pretty much sustaining their blood pressure. So you really have to be, very focused on your tasks. The dosages, all that is very important. So yes, you will use math in the future. And from there, I decided to go back to school one more time, and I got my master's degree in nursing. I am currently a nurse practitioner. As a family nurse practitioner, you're still a nurse, but you have, with a master's degree now, you have more responsibility. Now you are a provider, so you're kind of like a doctor, but in a nurse version, meaning that You can diagnose what a patient has. You can give them a diagnosis. You can give them a treatment plan. You can prescribe medications. I started working at Gateway Clinic first. There I did adults. I did adult medical, and I also did women's health. So it was quite an experience, fresh out of TAMU, I went to the place where people don't have insurance and they really need you to explain to them, to teach them. They're very complicated patients because they've never been treated before, and now they know that they have diabetes, hypertension, heart disease, kidney failure, and you're the one as a provider that oversees all of those problems for the patients. So I really enjoyed that job. There is a lot of education involved. You have to teach them what to eat, how to take their medications, when to take their medications, things that they need to look out for, side effects, stuff like that. Referrals, refer to a cardiologist or a kidney doctor if, depending on what the patient needs. I also did women's health, so I did a lot of well woman exams, so breast exams. I did find lumps, and I had to investigate, send patients for mammograms and, biopsies if there was a suspicious tumor. So it was a very educational for me, that experience at Gateway Clinic. And then from there, I decided to get another job where I'm currently at. I'm working with a hematologist, and he's also an oncologist. So basically, right now I see patients mostly like the way I'm seeing you guys, through the phone, through telemedicine, because of the current COVID pandemic. And there I get a lot of referrals from, their primary care physicians for problems or disorders of the blood, for example, anemia, or problems with their white blood cell count or their platelet count. So that's where I'm at right now. I'm not seeing any cancer patients at the moment, but in the future, I'm going to see patients that have survived cancer and they're currently in remission. And I'm going to have to, basically check them, make sure that they have all the cancer screenings up to date. So yes, nursing is a very rewarding career. There's a lot of room to grow, and it's never boring. If you don't like working at the hospital, you can work at the school as a school nurse. You can work in home health, visiting the patients at their homes. If you like the adrenaline, you can work at the ER, you can work in the ICU, you can work with babies, you can work in the nursery, you can work pediatrics. And then you can always go back to school and become a nurse practitioner like me, where you're actually the provider. You can, diagnose, like I said, diagnose a disease. You could, prescribe medication, order labs, order x-rays, order imaging, refer the patient to the specialist. So, and most importantly, be there for the patient as a provider, So just start thinking about what is it that you want to do, and just try your best. Right now you really need, what helped me is that I was always, top 10 in my class. I was very involved in high school. I was in band, I was in mariachi, HOSA, because I already knew that I liked, the medical field. So start thinking about what is it that you want to do, and get the best grades that you can, because scholarships really help me out a lot. It's amazing. Like, there's a lot of free money out there, but they're only going to give it to the students that are top students, and that they're not just top students, but they're also outgoing, they're involved in their community, they do volunteer, all of that. And it does pay off with the scholarships. And really, like, we are in the United States of America. Like, there is money out there. There is loans, federal student loans, that there's no excuse basically to get a career. And really, look at what is it that you want to do. And in my in my experience, like I wanted a job where I could help people, and I feel like every day I help people, and it's just very fulfilling for me to know at the end of the day that I help all these people and that they liked my service, because that's what it is. It's service. It's just like teaching. Nursing is also a service that you do to the community. I'm also a teacher. I teach sometimes at TAMIU. I teach the students that are in the nursing program because I enjoy teaching. So I also do that on the side. So feel free to, if there's any questions, you can email me. My email is elenareyna1984@gmail.com. Good luck, guys, and I hope you guys are staying safe. It's very important for you to keep wearing your masks, stay home. I know everybody wants to be out already in school, but really I think until we get this vaccine distributed and approved for everybody, I think that's probably when we're going to start seeing the decrease in the numbers. So just in the meantime, hang on and just try to learn as much as you can with the virtual learning. I know it's not the same, but we do what we can with this problem. Keep washing your hands, wear your mask, and do it not just for you. Remember that you have parents and grandparents, and they may have other things going on. They may have other diseases or comorbidities that put them at high risk. So just take care of yourself and also take care of your family. God bless you guys.